Hi, this short video is to present you a research-based case from a public sector hospital. The case tells a story about an ordinary nurse who wanted to do something differently at her work. I have been involved in this research from the very beginning and found it not only fascinating, but also most informative. It clearly demonstrates the boundaries which an individual needs to cross within an organization to be able to make her dream or vision to come true. Although the findings very much relate to individual level risk-taking of this nurse in question, they are also informative of the organizational structures, practices, and culture, which in this case make it harder for the nurse to behave entrepreneurially. The story begins with the fact that the nurse felt bad about the long waiting list and timely queuing of the patients to get the treatment. Furthermore, she saw that the doctor's time was not well exploited as they needed to meet all the patients at any phases of the treatment, even the most simple follow-up cases, which they did not find challenging at all. On the contrary, they found these routine cases rather frustrating, although very time demanding. In a training course, the nurse had heard about a nurse-run practice, which had been successfully running some elsewhere, and she became interested in it. The basic idea was that the nurse could take the routine cases from the queue, which would then release some time for the doctors to focus on the first-time patients who need to be thoroughly inspected, and also more demanding cases. Naturally, this would imply some extra training for the nurse, but the outcome would be more efficient treatment process in general, shortening of the long queues, more interesting job both to the doctors and the nurse, more flexibility in the resource exploitation of the clinic, which actually implies both individual and organizational benefits. As simple as that. Everybody's happy? You might think so, but not at all in a real life. Making her dream come true required the nurse to cross several organizational boundaries in order to be able to open up the nurse-run practice. First, she needed to ask her supervisor permission to get some more training and then to start opening the practice. Well, the supervisor obviously was not for it at all. She did not literally deny it, but just ignored her request, but by only stating that the idea was nice, but she did absolutely nothing to let the nurse to further develop the idea. So in order to be able to proceed, the nurse needed to look for support from some elsewhere, as her immediate boss was not to give any support to her. In that sense, she took a personal risk as she needed to bypass her own supervisor. I will get back to how this all happened a bit later. Given that the immediate boss was not for the idea, it was quite easy to understand that any support from the closest colleagues was also lacking. No one dared to support the idea as the boss was not for it. So the nurse was left by herself without any organizational support from the closest ones. She was there with her great idea, but without any support from the colleagues nor the boss. Any other challenges for her to tackle? Well, yes. The very reason she got interested in the nurse-run practice in the first place was that she had a holistic understanding of her and the clinic's operations. This is something the nurses are not supposed to have. She was not only interested in her own work, but also in one of the doctors, as well as the efficiency and resources used of the clinic as a whole. Most importantly, she was worried about the service provided to the patients who needed to suffer while waiting in a queue to be treated. So the nurse was clearly looking beyond her own job description and took into account the needs and interests of other stakeholders too. This is something that is important in entrepreneurship, and this is something that was also very exceptional for this nurse. Furthermore, her idea of a nurse-run practice challenged the hierarchy between positions and separate professions of nurses and doctors in healthcare. It is well known that healthcare is relatively strictly and hierarchically organized with two separate lines of commands, one of the doctors and one of the nurses, so that the one of the nurses is subordinate to the one of the doctors. This implies that she also challenged the idea of a nurse only assisting the doctor in a nursing situation, but wanted to see that also nurses can take an initiative and responsibilities in a nursing situation. From her point of view, the doctor does not need to be the king, but the doctor and nurse can rather collaborate in a flexible manner. This indeed challenges the subordinate position of nurses to doctors, as well as their strictly separated tasks, which have long traditions in the field, starting already from the education. So you can imagine this was not an easy boundary to cross over, as it interested even professional unions in the hospital. And finally, her idea of a nurse-run practice challenged something which is heavily embedded in public sector organization, particularly, namely the culture of equality. Everyone needs to be treated in the same way, no matter what one does, and irrespective of one's performance. Quite early, she noticed that she was not anymore given permission to get more training, as she would become too competent, or at least clearly stand out of the others. She would have liked to learn more, but obviously she had already too many responsibilities and roles that the boss was not willing to give her anymore. Naturally, the nurse felt quite bad about this. She was willing to invest her time and effort to improve the performance of the clinic, but the organization was not willing to support her in implementing her initiative, but wanted her to stand back rather than truly champion. How come she then managed to establish the practice? Indeed, she did. First, she got some support from another doctor from another unit or department. This doctor encouraged her to develop the idea further and even gave her some feedback and support that she was definitely lacking. Eventually, the nurse wrote a kind of a business plan of a nurse-run clinic to demonstrate its feasibility and potential. One day, she decided to send this business plan over to an initiative box of the hospital. The hospital namely had a system that employees can send over the development ideas. The managers in the hierarchy evaluate them and finally decide whether and how the ideas can be implemented. This was actually the way in which the nurse finally bypassed her own boss by sending in the initiative and suggesting such a practice to be launched. She did eventually get enough support from the top of the hierarchy to be able to launch the idea. You may imagine that this was not the most pleasant thing for those who had not been supporting her from the very beginning, but nevertheless, the nurse-run practice started to run. So, what do we learn from this case from the point of view of entrepreneurship? From the point of view of entrepreneurship. Yes, first, the case clearly demonstrates that it is fully possible for everyone to act entrepreneurially, even in a large public healthcare organization. So if it's possible there, I believe it's possible elsewhere too. I am not claiming that it was easy. No, not at all. As I just demonstrated to you, it was difficult, but it is fully possible. Second, this was a story about an ordinary nurse. You do not need to be a superhero or with extraordinary talents, but being just a normal person is enough. What is more important is what one does in order to make things happen. One does not become humiliated or discouraged after the first threshold, but is willing to continue and find one's way out. If one route will not work, then there is another one to go for. This is how our nurse was eventually able to make her dream to come true. Finally, the case reveals a variety of organizational boundaries the nurse needed to cross or stretch in order to be able to set up her practice. Although the study takes place in a large public hospital where such boundaries are quite heavy, I'm sure many similar types of boundaries, in addition to some others, may exist in any other setting. So it is important to understand that oftentimes such boundaries need to be tackled when one wishes to act entrepreneurially in an existing organization. On the other hand, the organization can take measures to lower these thresholds in order to exploit the innovative capabilities of the employees. So what? As said, it is important for managers and employees to understand that there likely are different thresholds and obstacles within the organization that need to be lowered or removed so that the innovative potential of employees can be exploited. Entrepreneurship is not always evident and easy, but it is possible if people really want to make things happen. In addition, the case demonstrates that entrepreneurship also implies taking personal risk. For example, by bypassing her immediate supervisor, the nurse took a personal career risk. The case also demonstrates the importance of communication channels between the employees and organization. In this case, it was the initiative box through which the idea of an employee was channeled to the management, as the immediate supervisor originally blocked the idea. Corporate entrepreneurship indeed is a co-evolutionary process in which the ideas of individual employees and management meet and finally develop into entrepreneurial actions. Any organizations need to have forums through which the ideas can boldly and openly move between the actors. Open and bold communication from top down, and most importantly, from bottom up, is thus of great importance here. So, this was my research-based story of an ordinary nurse who wanted to make a difference and who also managed to do so. It was not easy for her, but she made it happen. This can encourage us all to make our own legacy. I hope this case has inspired you to your own entrepreneurial endeavors and made you also to think of the organizational antecedents of entrepreneurship. Thank you for listening.